Okay, Oklahomans. That's my dick's pink. It's a succulent, but I gotta stop with the succulent gardening here for a minute and give a shout out to Oklahoma City Mayor David Holt. And I would like to also give a shout out to Dr. J.L. Jacobs, who in 2009 published a study called The Use of Surgical Face Masks to Reduce the Incidence of the Common Cold Among Healthcare Workers in Japan. I'm sure that our mayor in Oklahoma City here has not read that study, but I put it in big bold letters here in a big font. I just went through the abstract and made sure that the pertinent part was reproduced here in bold for Mayor Holt. And it reads, N95 masked healthcare workers were significantly more likely to experience headaches. Face mask use in healthcare work was not demonstrated to provide benefit in terms of cold symptoms or getting colds. So we knew back in 2009, but maybe Mayor Holt doesn't believe in science. Let's see, 2010 we had Dr. Cowling, it looks like, face masks to prevent transmission of influenza virus, a systematic review. Okay, Mayor Holt, none of the studies reviewed showed a benefit from wearing a mask in either healthcare workers or community members in households. There's a table 1 and 2 therein, so please, if you need tables, if this isn't enough, go to Epidemiology and Infections website, or you could go to Cambridge.org, and you can see that's probably who sponsored the study. So let's go down to this 2012 study, the use of masks and respirators to prevent transmission of influenza, a systematic review of the scientific evidence. This was published in Influenza and Other Respiratory Viruses in 2012. Mayor Holt. Did you read this one? Oh, I did. Here's the synopsis of the abstract right here. There were 17 eligible studies. None of the studies established a conclusive relationship between mask or respirator use and protection against influenza infection. Now, if you don't know what the difference between mask / respirator, a respirator is like an N95, like something that constricts your breathing through a filter, where a mask is just sort of more passive. What they might call it, a surgical mask, or just putting pieces of cloth and layers across your face is basically a mask. So this study is actually these 17 eligible studies that were reviewed. They couldn't establish any conclusive relationship between a mask or a respirator and protection against influenza. Okay, so now we got Dr. J.D. Smith here in 2016. Effectiveness of N95 respirators versus surgical masks in protecting healthcare workers from acute respiratory infections. So, of course, you'd want to know if you want to have upgrade the N95s if they're helpful. Well, we identified 6 clinical studies. In the meta-analysis of the clinical studies, we found no significant difference between N95 respirators and surgical masks and associated risk of laboratory-confirmed respiratory infection, influenza-like illness, or reported workplace absenteeism. So, again, wait, we got one more. Mayor Holt. This one's from 2017. Effectiveness of masks and respirators against respiratory infection in healthcare workers. This was published in Clinical Infectious Diseases. Self-reported assessment of clinical outcomes was prone to bias. Evidence of a protective effect of masks or respirators against verified respiratory infection was not significantly significant. Now, this is important right here because this points out the need for verified outcomes. If you don't know what verified outcomes mean, that means that you don't just get to take the word of the healthcare workers, whether or not they felt better or not with a certain mask or without a mask, whatever the experiment is, whatever the study is. They need to verify the fact that they did indeed not get virological transmission as much as people that use different types of masks, which they have never been able to do. So here we got last year, Dr. Radnovic, N95 respirators versus medical masks for preventing influenza among healthcare personnel, a randomized clinical trial. Among 2,862 randomized participants, 2,371 completed the study and accounted for 5,180 healthcare worker seasons. All right, that's a lot. Among outpatient healthcare personnel, N95 respirators versus medical masks as worn by participants in this trial resulted in no significant difference in the incidence of laboratory-confirmed influenza. So again, N95 masks not doing anything versus a surgical mask, okay? And from this very year, why long effectiveness of N95 respirators versus surgical masks against influenza, systematic review and meta-analysis. This is in, it's just a straight up online publication, so this might not have even been peer reviewed yet. I don't know how this online Wiley library works here. A total of 6 RTCs. Now, if you don't know what total of 6 RCTs, okay. So a total of 6 RCTs involving 9,171 participants were included. There were no statistically significant differences in preventing laboratory-confirmed influenza, laboratory-confirmed respiratory viral infections, laboratory-confirmed respiratory infections, influenza-like illnesses using N95 respirators and surgical masks. The use of N95 respirators compared with surgical masks is not associated with a lower risk of laboratory-confirmed influenza. Now, here's the other thing you got to remember. They're looking at laboratory-confirmed influenza, right? So, of course, the studies over here are looking at it from a perspective of people that work in an environment that are going to come into contact more often with these viruses than we do. So just remember that as well. What I was stumbling over before, what I wanted to say is this acronym right here, RCT, that stands for Randomized Control Trial. RCT is super important. If you don't have randomized control trials in a study that you're trying to cite, you can just piss off. Like, you need randomized control trials, and you need predicted and confirmed outcomes. You know what I mean? You need to use a randomized control trial, predict what you think is going to happen, and then actually confirm that what happened. Don't just go to these healthcare workers and say, oh, you felt better? Okay, well, it helped you. All right. One more thing here. I got some more shit back here for you, but let's just look at this one right here, just to close out here. So this is U.S. weekly deaths, all causes. This is week by week, starting in 2017, 2018, and going through 2019, 2020, okay? That gray line right there is the actual number of people that died. That red line is the trend. Now now since COVID and stuff started hitting and these analyses have been happening more often, we've had multiple data sets to work with, right? So if you see, there's some data from April 5th and then March 30th, etc. But check this out. Here's the trend, right? You had over 65,000 people died in the 2017-2018 season, all right? But here you go. Here's last year, and here's this year. What do you notice? You notice a trend, right? This trend has been going on since before humans were even Homo sapiens. Primates and these viruses have been coexisting in this way with this pattern for millions of years. Mayor Holt